Namaste to you. This is the 24th day of May 2020. As we keep on shooting video clips after video clips with the experiences of the most experienced oncologist in India, Dr. CP Mathew, sir, I would like to today ask his or seek his opinion about not so popular but very effective method of intervention called chelation therapy. And I think having access to a data of more than 200,000 episodes of chelation therapy, I think I would let him narrate us what we should be aware of.
Chelation therapy is there from 1930. Actually, it started in Germany. It is a drug discovered in Germany, EDTA, ethylene diamine tetraacetic acid. So the short form is EDTA. Now we call this treatment EDTA chelation. Now they found in the ship painters where gallons and gallons of lead paints are used, they had lead poisoning, a number of ship painters. Now this discovery of EDTA was to eliminate lead from the body. Now it started in 1930, and then in the process of this lead treatment, they found patients having cardiac problems, congestion, the failure, heart failure, this thing and all that, they had marvelous improvement. And on examination, they found, along with lead, calcium also is removed. You know, atheromatous changes in the arteries is the cause for many, many diseases. Now, this famous physician, Deepak Chopra, said, if you can eliminate calcium from the body, that is, if you can eliminate atherosclerosis, 90% of diseases can be solved. So this is a treatment, chelation treatment is removal of the calcium from the body, that is otherwise called treatment for atheromatous changes in the arteries. Now from 1930 onwards, people started using this for heart patients, cardiac patients where coronary arteries were closed with calcium. You know, when you build a building, you have plumber work throughout the body. Now, when after 25 or 30 years, when you open the wash basin tap, there is no water coming. Now the problem is blocking of the arteries or the plumbing, pipes. The same blocking is happening in our body after 40, 45 because of calcium deposit. This is called atheromatous changes. Now, if you can prevent atheromatous changes, the human life will be 120 years, according to Deepak Chopra. That is the history of chelation. And there are so many centers in America, and there are chelation doctors association in Europe. But in India, somehow it was not popular because there is a strong lobby against chelation, the bypass lobby, because it is a multi-billion-dollar business. So they are against popularizing chelation. But if you resort to chelation, you can solve 90% of cardiac problems. That is the story. We have given about 2.5 lakhs of chelation injections in our center, and we found there was not even a single complication, not even a single complication out of this 2.5 lakh injections. That is the beauty of chelation. So I recommend that everybody beyond 40, especially people who are addicted to alcohol and smoking, they should undergo chelation therapy. It is nothing but a rejuvenation therapy. It is not for any particular disease. It is for general rejuvenation of the body.
So, continuing on this topic, I'm not commenting on chelation at all. That's not my domain to even think or comment about. Nevertheless, it is very interesting noting from the observations made by Sir that in the science of Ayurveda, Rasayana, which is in fact you call it rejuvenation or regeneration, or ensuring the most vitality of every cell of the body, whichever of these narrations are suitable to you to confirm to this idea, is basically recommended in Purve Vaisi Madhye Va, which means early age or middle age. So even if you take 100 years as a normal human lifetime, which was what originally the text would recommend, 100 or even 120 years, it perfectly fits in into the age group of 40 onwards. So it's basically 35 plus, and 40 plus is the time when it's high time to think about the regeneration aspect of the body, when the decay is going to start anyway in different forms. And all of us know we are losing a certain percentage of the brain matter physically itself, means organically, structurally, after the age of 30 anyway. So this is how it's the right opportunity for any individual to think about preventing diseases by acting smart in advance.